Salmonella and Shigella. Both of these are members of Enterobacteriaceae family. They are gram-negative rods, facultative anaerobes, and non-lactose fermenters. I will classify Salmonella and Shigella and will discuss modes of transmission, pathogenesis, clinical features, and laboratory diagnosis of Salmonella and Shigella. I will also simultaneously compare differences between Salmonella and Shigella. Classification of Salmonella. There are many classifications of Salmonella. Like there is Ewing classification, which divides the genus Salmonella into 3 species: Salmonella typhi, Salmonella Cholerae, and Salmonella Enterocolitis. Then is DNA hybridization classification, in which again Salmonella is genus and there are 2 species, Salmonella enterica and Salmonella bongori. This first one is important. Salmonella enterica has further got 6 subgroups, and this is on the basis of somatic, flagellar, and VIST capsular antigens of Salmonella. This species, enterica, has subgroup 1, which is again enterica. Though there are 6 subgroups, but we would just discuss this subgroup 1 because these strains are pathogenic to humans. So only this subgroup is important for us. So if I have to write down Salmonella typhi with this classification, then I would write Salmonella enterica, which is Salmonella is a genus, enterica is species. Then comes the subgroup enterica again, and then is serotype typhi. Now what is serotype? A group of closely related microorganisms which are distinguished by a characteristic set of antigens. They are called as serotypes or serovars. Then is Kaufman and White classification of Salmonella. So you can see different groups. Actually, these groups are more than D, but I have just written these important groups which contain Salmonella paratyphi A, B, C, and then is Salmonella typhi. And this classification is based on somatic and flagellar antigens. In case of classification of Shigella, there are only 4 groups, and the division is on the basis of somatic antigens in the cell wall of Shigella. So you can see different types of species of Shigella. Shigella is a genus, then there is a species which is dysentery, flexneri, etc. Modes of transmission of Salmonella. Salmonella typhi, Salmonella paratyphi A, B, and C. Both of these are spread through fecal-oral route or through carriers. Carriers are the ones who are asymptomatic themselves, but they can spread infection to other people. And through fecal-oral route, which involves fingers, flies, food, and feces. And only humans are the reservoir in these species. But if you talk about the Salmonella Enterocolitis and Salmonella typhimurium, then animals are the reservoir. And if you see the modes of transmission, the source is poultry, meat, milk, foods of animal origin. And foods can get contaminated with lizard, rat, and other animal because of its droppings, salad, or uncooked vegetables which are contaminated through manure or by handling. So the mode of transmission would be the animals. So this would also be known as Salmonella gastroenteritis zoonotic disease if you talk about the disease name. So it is zoonotic in nature. Modes of transmission of Shigella. Again, it is spread through fecal-oral route, and we have discussed fecal-oral route involves fingers, flies, food, and feces. Unlike Salmonella typhi and Salmonella paratyphi A, B, C, there is no carrier state. Unlike Salmonella enterocolitis and typhimurium species, no animal reservoir, so just humans are the reservoir in case of Shigella. And please remember, this disease is common in children less than 10 years of age. The outbreak is common in nurseries and mental hospitals. Pathogenesis of Shigella. The infectious dose of Shigella is 100 microorganisms and incubation period is 1 to 4 days. Shigella causes disease which is exclusively in the GIT tract, so there is no bacteremia. Shigella are taken up by M cells in the large intestine by endocytosis, and these bacteria are quickly released from the endosomes and leaving Shigella free in the cytoplasm. The bacteria multiply at the, you can say, inferior and lateral aspects, and actin filaments quickly form a tail and push the bacteria into neck cell, where they keep on multiplying, and macrophages that take up Shigella are killed and they release the organism. So the infected cells, they die and slough off. Acute inflammatory response occurs with the bleeding and abscess formation. So basically the clinical features start from fever, abdominal cramping. Initially there is watery diarrhea followed by bloody diarrhea. So the disease is Shigella enterocolitis or bacillary dysentery. It will resolve in about 2 to 3 days. Another important point is the Shiga toxin, which is the enterotoxin produced by Shigella, is similar to the enterohemorrhagic strain of E. coli. Pathogenesis and clinical features of Salmonella. Salmonella enteric fever. Salmonella paratyphi ABC produces paratyphoid fever. Salmonella typhi produces typhoid fever, and enteric fever is a broad term which includes both of these types of fever. Then is enteritis and typhimurium. We have said that it produces zoonotic gastroenteritis. Salmonella cholera suis mostly produces septicemia, though other species can also produce septicemia. Salmonella enterocolitis. Pathogenesis. Ingestion of organisms like Salmonella, Enteritis, and Typhimurium. There is colonization of lower intestine, ileum and cecum. Mucosal invasion is there and cytotoxins are released. There is acute inflammation, and along with that, certain prostaglandins, they are released, cytokines are released. There is activation of adenylyl cyclase with increase in cyclic AMP, and there is fluid production in the large and small intestine, and this results in diarrhea. The incubation period of the Salmonella enterocolitis is about, you can say, 6 to 48 hours after ingestion of contaminated food or water, and diarrhea is a cardinal manifestation, along with nausea, vomiting, abdominal cramps, headache, fever, and the duration of diarrhea and fever lasts for about 2 to 7 days. Enteric fevers. So you can see there is Salmonella typhi, which produces typhoid fever. So we'll discuss the pathogenesis of this typhoid fever. So clinical features of the paratyphoid and typhoid fever, they overlap. Infectious dose of Salmonella typhi is 10 to power 6 per ml. Typhoid bacilli enter through oral cavity with an infectious dose of about 10 to power 6 to 10 to power 9 per ml with food or water. They pass through the stomach pH and duodenal bile pH. In small intestine, it attaches with the enterocytes and enters into Peyer's patches and mesenteric lymph nodes. From here, it is going to reach to thoracic duct, and then it comes inside the bloodstream, and this is known as primary bacteremia, which occurs 7 to 10 days after entry. The organism circulates in the bloodstream and reaches various body organs, including reticuloendothelial system, for example, lymph nodes, spleen, liver, bone marrow. It again invades bloodstream, and this is called as secondary bacteremia, which occurs in first week. And finally, there is damage, and the outcome is the organism can pass through liver and bile to the intestine and passes in stool in second week, or the organism may invade renal parenchyma and can pass in urine during third week, or it can be converted into a carrier state. Clinical features of typhoid fever. The incubation period is from 10 to 14 days. During first week, there is malaise, headache, sore throat in prodromal stage. Then is classical step-ladder pattern of fever over 4 to 5 days, accompanied by headache, constipation, or diarrhea. Constipation is more prominent than diarrhea in adults. So what is step-ladder pattern of fever? Step-ladder pattern is the one where the temperature rises gradually to a higher level. And this is with every spike, so that a new plateau is reached higher than the preceding one, just like steps of a ladder. During second week, there is hepatosplenomegaly. There can be relative bradycardia, which means that there is an increase in heart rate of less than 10 beats per minute for 1 degree centigrade rise in temperature. Normally what happens, for each degree increase in temperature, there is a corresponding increase in heart rate of 10 beats per minute, but this does not happen in relative bradycardia. And you may find salmon-colored blanching maculopapules on the chest or the abdominal area. So they can be commonly present in gallbladder as a chronic carrier state and can also be excreted in stool and urine in carrier state. Systemic sepsis may be caused by species of Salmonella like Salmonella typhi and paratyphi. But the collar psoas is more notorious for producing septicemia, and the risk factors can be extremes of ages, immunocompromised patients, for example, sickle cell anemia, cancer, or a child with enterocolitis. Bacteremia can result from seeding of many organs. For example, there can be osteomyelitis in a child with sickle cell anemia. So there can be capillary occlusion secondary to intravascular sickling in the intestinal blood vessels, which can devitalize and infarct the gut and cause salmonella to invade. Similarly, areas of infarcted bone, they can be invaded by these salmonella, and mostly the risk is in long bones. So they can be salmonella osteomyelitis. Similarly, there can be pneumonia, meningitis, vascular graft infections in which mostly salmonella is involved, aneurysms, especially aortic aneurysms. They are sites of metastatic abscesses. So there can be bacteremia with or without metastatic infection. Laboratory diagnosis of Salmonella typhi and Shigella. Lab diagnosis day 1. Blood is taken in blood culture bottle, and this blood culture test is a gold standard. As Salmonella typhi can also come in stool and rarely in urine, you can take these specimens as well. And by now, I hope you know what are the proper SOPs of taking these specimens and when to transport these specimens, because we have discussed this a number of times in our previous Enterobacteriaceae lectures. On performing gram staining, gram-negative rods are found in case of blood culture. Methylene blue preparation is to find out the neutrophils. These are the neutrophils which are stained blue. And if the neutrophils are found in stool, it means any invasive microorganism is present, like Salmonella, Shigella, or Campylobacter. Apply the specimens on specific culture media. Like for blood culture, you need to subculture this on blood and McConkey's agar. In case of urine, on Cled agar. You can also apply certain selective media if you're suspecting Salmonella or Shigella infection. Incubate this overnight at 37 degrees centigrade, and on day 2 you will notice the growth on different culture media. On blood agar, you will notice that there are gray colored mucoid colonies in certain strains. In case of McConkey's agar, you will find non-lactose fermenting pale colored colonies. SS and XLD agars, both of these are selective media. The SS agar has got neutral red as an indicator, and XLD has got phenol red as an indicator. In case of SS agar, colonies would be pale colored and they will have blackening in the center in case of Salmonella typhi. If you talk about Salmonella typhi in case of XLD, xylose-lysine deoxycholate agar, the colonies would be pink in color, having black centers. In case of Shigella, colonies would be again pale colored, but there would be no black centers because there is no H2S production. Similarly, in case of XLD, the colonies would be pink in color with no black centers. Actually, you cannot find out pink colored colonies because there are black centers which are hiding these colonies. You can just see this yellowish color, colored colonies. So in case of CLED, the NLF colonies are bluish in color. You can perform gram staining from culture media and you will find gram-negative rods. In bench tests, both of these are catalyst positive, but Salmonella is motile and Shigella is non-motile. Go for biochemical tests and sensitivity, apply this and incubate this overnight at 37 degrees centigrade in an incubator. On day 3, you will interpret the biochemical test results. In case of Salmonella, the TSI reactions are alkaline slant, acidic butt with H2S production, and that is why there is blackening and you cannot see the acidic butt. And obviously gas negative. It is methylbrite positive, rest of the reactions are negative in case of Salmonella typhi. Citrate is positive for rest of the species except Salmonella typhi and Salmonella paratyphi. So it means Salmonella typhi is citrate negative. Day 3 for Shigella. TSI reactions, alkaline slant, acidic butt with no H2S, no gas production. And again, it is MR positive, just like Salmonella. Rest of the reactions are negative. Alternatively, you can also apply API 10S or API 20E if you don't want to go for conventional biochemical tests. Read the sensitivity, read the serology, and you can perform this with the help of polyvalent and monovalent antisera. If summary of Salmonella and Shigella. Typhoid fever in case of Salmonella, bacillary dysentery in case of Shigella, reservoir, humans and animals, and here only humans. ID50 is high, and in case of Shigella it's low. ID50 is 50% infectious dose. Salmonella is motile, Shigella is non-motile. Shigella is not going to produce H2S, whereas Salmonella would produce H2S. Diarrhea is not a prominent feature in case of Salmonella. Yes, it is a prominent feature in case of Shigella. Invasion of bloodstream, yes, in case of Salmonella, because bacteremia, it's a very important feature of Salmonella. Shigella, no. Chronic carrier state, yes, in case of Salmonella. No, in case of Shigella. And yes, there is a vaccine for Salmonella, but not for Shigella. Thank you.